There's an important relationship between the aims of an educational programme and the methods used for teaching and assessment.
And that relationship, that triangular relationship, was described first by Tyler many years ago. And what is important about it is that the assessment method is aligned with the aims and with the teaching methods. That's the whole point, that if you're wanting to go in one particular direction, getting the assessment right is terribly important. So some people say assessment drives the curriculum. Actually, there are lots of things that drive the curriculum. Individuals' intrinsic desire to learn drives the curriculum. But there's no doubting the fact anyone who's turned up for an exam realises that exams and assessments make a difference. So recently, workplace-based assessment has become important because, after all, in an educational programme, we're trying to improve the performance of professionals within a clinical context. So looking at them in the context of the workplace seems to be a useful and important thing to do.
One educational concept that can help in understanding how workplace-based assessment works is to think about the validity and the reliability of a diagnostic test or an educational assessment method.
Now, validity in a modernist context refers to the truth, the closeness to truth of what something is measuring. On the other hand, reliability is about the repeatability of the assessment method. And I find the most useful way of thinking about this is to think about arrows going towards a dartboard. If you look at the top left, you'll see that all the arrows end up on the bullseye, so they're all close to truth. If you look at the bottom left, although all the arrows are reaching the same target, it's off-centre. So although they agree each time and the reliability is high, it's wrong. You've got the wrong answer. You can see in the top right of the diagram that the validity, the closeness to truth, is still good. All the darts are centred around the bullseye. However, if you just look at one individual dart, it could be any old place. They're spread out, so the repeatability, the reliability of the assessment method is not terribly good. In the bottom right of the diagram, you've got the worst of both worlds. Not only are you getting the wrong answer, you get a different answer each time you try this assessment. So this concept of validity and reliability have been used for many years in order to assess an assessment method, and I'd like to move on to think about how it applies to workplace-based assessment.
To do so, here's another educational concept, Miller's pyramid.
Miller talked about a pyramid of clinical competence. And at the bottom layer of Miller's pyramid, the trainee knows something. There is knowledge. And that might, for example, be checked by a multiple choice question. The next level up is knows how. And that's about the application of knowledge. And that might be assessed by a short answer question. Going up further up the pyramid is shows how. And this is showing competence in ideal circumstances. So, for example, when there's no pressure of time, perhaps you're in a clinical skills laboratory and you're able to demonstrate that you're able to undertake a procedure. Right at the top of Miller's pyramid is does. This is actually what happens rather than competence. So what Miller pointed out was that as you go from the bottom layer of the pyramid towards the top, there is increasing validity. You're getting closer and closer to truth of what you want to measure. After all, when I go to see my general practitioner, I'm not particularly interested in whether this practitioner has scored well on a multiple choice question. What I'm really interested in is in the busy morning surgery when that practitioner is running late, whether he or she will listen to me, will take into account my concerns, and will be able to make the correct diagnosis. So this is about much more than simple application of knowledge. It's about doing it in real life. But the other thing, and this is the really important thing that Miller pointed out, was as you go up the pyramid, reliability, repeatability gets less. So if you want a highly reliable test, just get some really well worked out multiple choice questions. If you're looking at performance in real life, that practitioner might be having a bad day. This particular case might not be typical of other cases. So just taking one snapshot may therefore have a poor reliability. Now, other people have pointed out that the reliability of a test isn't the be-all and the end-all, and actually you need to have utility in this test, and that utility of the test partly depends upon how it drives learning, and also validity. Is it about performance in the workplace? And acceptability. Lots of other factors have been put into a formula, and reliability is only part of it. So in workplace-based assessment, the problem of poor reliability is overcome by having multiple assessments by multiple assessors to build up a picture of an individual. I might, for example, look at a case-based discussion of a trainee on one occasion, and one of my colleagues might do another case-based discussion.
In this way, a number of different assessors will help in building up a picture of the trainee. This is exactly what is represented by the dartboard, showing lots of arrows centred around the truth, but each dart on its own having a low reliability.
So if a couple of your assessors tend to be hawks, another assessor is a dove, although you will try to do some training of those assessors to calibrate them and bring the hawks and doves closer together, nevertheless there will be differences between the individual assessors, and by using multiple assessors that variation to an extent will be cancelled out. And by using multiple different assessment methods you will be able to build up a picture of this doctor. There's one other useful idea here, which is the idea of triangulation. And this comes from geography. If you're trying to find out where a mountain is, and you've got a map and you take a grid reference, you know that somewhere along that line is the mountain. But to be sure of precisely where it is on the line, you need to walk several hundred yards and look at the map again and take another bearing. That way you triangulate. From two different points you identify exactly where the mountain is. Using that analogy, here in workplace-based assessment, there's not just one assessment methods. We can use a number of different methods to triangulate where that person is. So it's no coincidence that one method will be assessing professionalism and another method will also be assessing professionalism. It's regarded as really rather important that the different methods overlap in what they are assessing.
So work-based placed assessment is designed to look at the most important aspect of a professional's performance in the workplace, what they actually do, the very top of Miller's pyramid.
The problem with this is that a single measure has low reliability, and the aim is to take multiple snapshots to build up a picture so that the reliability depends upon the reliability of all the assessments, not just one.
Here are some questions that are intended to get you thinking about this subject in greater depth. To what extent do you agree with the arguments presented here? What would a critic of workplace-based assessment say? Is it really fair to expect the hawks and the doves to cancel each other out? If you wish to explore this topic further, a good starting point is our e-learning module on workplace-based assessment. Go to faculty.londondeanery.ac.uk/e-learning and select the topic from the left-hand panel. If you're a student on our postgraduate certificate course, you'll find references and suggestions for additional reading within the online resource folder.